Hey guys, Doc Hepps here. So you're getting up at night like a million times. What's going on? How can you slow this down? Listen in and we'll give you the scoop on how to reduce your nighttime frequency. Hey guys, it's Doc Hepps. So you're going to the bathroom all the time at night? That's the question we're going to go over today. Make sure you stay tuned to the end where I'll give you my tips and tricks how to reduce your nighttime frequency. So nighttime frequency, we call this nocturia. It's very common and there's many different things that can affect why you may have to go to the bathroom at night. Sometimes this is associated with daytime frequency, and sometimes it's isolated to folks at night. Occasionally, you'll have some daytime issues, but you can manage it. You're awake, you can go to the bathroom, it's not a big deal. But getting a good night's sleep is essential. And if you're getting up to the bathroom all the time and it's difficult to go to bed, that can really compromise your quality of life. So we're going to go over what nocturia is, what's normal, maybe why this happens, and some options for treatment. So first step, what is nocturia? Well, it's simple. It's getting up to urinate at night. Overall, I would say getting up 1 or 2, potentially 3 times can be considered normal as long as you feel rested and you're getting a decent night's sleep. The next step is why. Why does nocturia or nighttime frequency occur? Well, in some folks, it's simple, and in most folks, it's a tricky situation. In men, obviously, they have a prostate, and so as a prostate enlarges, the bladder works harder and harder against that prostate. It can scar in, and the bladder just doesn't hold as much fluid, and that causes increased urinary frequency. Oftentimes that occurs both day and night. So if we can open the prostate by using medicines or surgery, sometimes that can improve the capacity of the bladder over time and subsequently reduce the urinary frequency both in the day and nighttime. But most times it's not that simple, and it's a constellation of many different things. Obviously, ladies don't have a prostate, so sometimes we attack the bladder issue by trying to figure out, is the bladder overactive? Does the bladder fill and all of a sudden it wants to push that urine out? Now, overactive bladder occurs for a multitude of different reasons that we'll discuss in other videos, but it can cause some both daytime and nighttime frequency. There are different treatment options for overactive bladder. In some folks, the nighttime urination comes from excess fluid that is in our body called edema. And that edema can build up throughout the day and then remobilize through our tissues overnight and go to the kidneys, and we make too much urine because that excess fluid gets mobilized into our system and it gets excreted more exclusively in the nighttime. Another thing that can cause nighttime frequency is a hormonal problem. So there's medicine that can help counteract our body's natural ability to produce excessive nighttime urine. Now, some folks produce more than 1/3 of their urine production in the evening. And sometimes we'll have you do something like a voiding diary where you measure how much urine you're making overnight versus how much you're making during the day. And if you're producing excessive amounts in the evening, we may attack it by changing up a certain hormone using a medication to try and reduce that volume of urine at night. Another thing that is not intuitive but can cause nighttime frequency are sleep problems. So, for example, some folks have sleep apnea and they have poor sleep that causes a specific hormone to be released that causes excessive urine production. And by treating the sleep problem, you'll not only have better sleep, but you'll have less urine production and subsequent won't have to go to the bathroom as much in the evening. How do we treat this? Well, as I mentioned, we try and treat the underlying problem. Oftentimes when you come to the urologist, we'll do a history and physical exam. Sometimes we'll try as our first step just a medicine. And that can be a medicine, obviously a med geared towards the prostate, such as Flomax, or something to shrink the prostate, such as finasteride. And many times that hits the target. If that doesn't, there are other medicines that work on the bladder called overactive bladder medications. There's two different general varieties of that. A more traditional medicines called anticholinergics, a newer, more selective, less side effect medications called beta-3 agonists to treat that bladder overactivity. And we might use these medicines in combination to try and help with your nighttime symptoms. Along with that, we'll do an exam to assess if you have any leg edema or swelling of the legs. We may recommend in that case that you lift your legs in the afternoons rather, to try and mobilize some of that fluid. Because at night, if you're lying on your back with your legs up, all that fluid will remobilize into your system, through your heart, into your kidneys, and your body just wants to get rid of it, and you're making all this urine. And by lifting the legs in the afternoon and trying to reduce that swelling, you can reduce your nighttime frequency. If we do ask you to do a voiding diary, sometimes that can be helpful in understanding, are you an excessive urine producer? So if you make tons of urine at night, there is medicine called Desmopressin that may be appropriate for you, that may affect how the kidneys get rid of fluid. And in some folks, this can be a very effective way of reducing the nighttime urine production and helping you get a better night's sleep. Lastly, we may ask you to get a sleep test. We may ask you or your wife to determine if you have any issues with snoring. And that can be an indicator that you might have sleep apnea. And if that's the case, we'll ask you to go ahead and get a sleep study. We'll order it, or your primary care will order it. And if that suggests that you might have sleep apnea, by wearing a special machine may get you a better night's sleep and reduce your nighttime frequency. So here are my tips about trying to reduce your nighttime urinary habits. So number one, limit your fluid intake in the evening at least 2 hours before bed. Try and limit your intake of any caffeine, alcohol, as these can have somewhat of a diuretic effect. Try and assess your medications. Are you taking any diuretics or medicines that are designed to get rid of fluid? And if you're taking these in the evening, then that's going to make you get up a lot at night. So if you can talk with your primary care or who's ever prescribing these medicines to adjust their schedule, that will help. If you have any swelling in your legs, raise your legs in the afternoon to try and get rid of some of that swelling before you go to bed. If you have snoring problems or sleep issues, then get checked out by your PCP to get a sleep study to see if you have sleep apnea. Talk with your urologist because he may do some studies to better understand, are you an excessive urine producer at nighttime? Do you have an enlarged prostate? Do you have an overactive bladder? Because there are medicines geared towards each of these components. Sometimes we use a combination of these meds to get you a better night's sleep. So again, this is Doc Hepps. Hopefully you enjoyed this video and gave you some guidance as to nighttime frequency or nocturia, and some tips as to how we approach it and what you can do as a patient to try and get a better night's sleep. Thanks for watching. Subscribe to our channel. Check out our other videos. I appreciate your time.